Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. So, in the today's this very important session, we will discuss the very important skin conditions, skin infections, and the terminologies, and along with that, a very important image-based questions on the skin infection and how to identify that one and how to choose the correct answer on the dermatology portion in the Norcet. Yes. Many questions will arise from the skin conditions, like from the burns, fluid calculation from the burns, infection of the burns, and many times they have asked the rashes and how to identify that one immediately and how to choose the correct answer while seeing the images. So that thing we will explain here clearly. So all of you have to do is to watch the video till the end, and if you found the content helpful, so don't forget to subscribe to the channel and hit the like button. Okay, so before going to the main topic, here we have a beautiful information for you all. So that is Norcet 9 Super 60 test series. So this plan which is available in our app. So if you want to become a part of this one, so you can download the Master Nursing Classes app. In the Super 60 test series, you will get the 60 completely planned and the very well designed and all the important questions integrated with image based questions, practical questions, scenario based questions, NCLEX based questions, fact-based questions, information-based questions, and the very important frequently asked questions. Everything you will get in the Super 60 live test series, which is completely planned by the expert team. So that will definitely give us a 5-star to your preparation, right? So this is the Norcet 9.0 Super 60 live test series, which is available in our app. Okay, so if you want to join this particular course, okay, just download the Master Nursing Classes app. And a gentle reminder for the tomorrow Sunday's free test. Okay, so every Sunday in the Master Nursing Classes app, there is all India level free test will be conducted. So that free test is very important for you all. So who all are not a part of this particular course, you can attend the test free of cost every Sunday. Okay, that's the very important information for you all. And in the Navagraha plan, what you will get? So in the Navagraha plan, you will get the completely quality and updated content for your upcoming Norcet 9. Here we will discuss the very important topic questions along with the complete clarity of the concept. So that will definitely strikes in the exam. Believe me, in the last Norcet, just a 15 video brought a 30 plus questions directly, and the very importantly indirectly you have got the 15 more questions. Okay, so in the 15 to 16 video you are getting the 45 plus question, means believe the content and trust the teacher. That will definitely give you a proper result. Okay, so here in the Norcet 9 Navagraha plan, we are giving the Super 60 tests. Along with that, we are giving the high yield topic classes. Okay, in the Navagraha plan. Okay, and if you want to become a nursing officer in the SGPG and KGM, here we have the Arambha series. Okay, so that already we have announced this course. Okay, so here you will get 3000 plus MCQs. That is the 30 completely according to the syllabus like test series you will get, plus a non-nursing classes. Okay, so you know that in the SGPG and KGMU, out of the 140 questions are related to the non-nursing. Okay, so all the non-nursing classes you will get in this particular Arambha series. Okay, and you will get the 30 very important fully designed model papers for your SGPG and KGMU exams. Okay, and if you want topic wise theory classes, so here is the master batch 1.0. okay, so this will give you a quick theory revision, okay, for your upcoming Norcet 9. Norcet 10 also it will be definitely helpful. Okay, if you want to become a part of this one, just do download the Master Nursing Classes app. The link I have given in the comment box and in the description box as well. Okay, so don't forget to give the tomorrow Sunday free test. So all India rank will be announced at the 11:30 p.m. at the night. Okay, so live will be test will be live from the tomorrow morning 6 a.m. Okay, so don't forget, right? So we will start the today's session now. Very important. Yes, so here is the topics of our discussion. So believe me students, these image based questions are the concept and the terminologies. So this will directly hit in your exams. Okay, just you have to understand the concept and you have to mark the correct answer to get the good rank. That's it, right? So we will discuss now the fungal skin infection. So there is one term we call as the tinea for the fungal skin infection. Okay, for the fungal skin infection, there is one term we call that one as in the tinea. Okay, so this tinea is the infection of the skin by the fungus. Okay, so that is a very important word. If the tinea means the fungal infection which is happening to the entire body, so we call that one as in the tinea corporis. Okay, so fungal infection of the entire body, we call that one as in the tinea corporis. Okay, if the fungal infection happening only in the groin regions, okay, only in the groin regions, okay, that is what we call the tinea cruris. Okay, so this is what we call as the tinea cruris, right? If the fungal infection which is happening to the foot, so that is what we call the tinea pedis. Okay, so tinea pedis, or we call this one as in the athlete's foot also. Okay, so what we call this one? We call this one as the athlete's foot. Very, very important. Keep in your mind, if the infection which is happening to the hands, okay, so the fungal infection which is happening to the hands, so we call this one as in the tinea manum. Okay, so very, very important. If the fungal infection which is happening to the scalp, means to the head area, so where we will put the cap, we will put the cap to the head. Okay, so that is the cap. Okay, that is the tinea capitis. Okay, tinea capitis will be the fungal infection of the scalp. Very, very important. If the fungal infection which is happening to the nails, so that one what we call as the tinea unguineum or the onychomycosis. Okay, so what we call that one is the onychomycosis or the tinea unguineum. Okay, so that is the fungal infection of the nail. Very, very importantly, yes, let's quickly revise all the golden points. A fungal infection of the entire body is called as the tinea corporis. The fungal infection of the groin region is called as the tinea cruris. The fungal infection of the feet, we call that one as the athlete's foot or the tinea pedis. Okay, so fungal infection of the hand we call as the tinea manum, and the fungal infection of the scalp, which we call as the tinea capitis. Okay, very, very important words. And the fungal infection of the nail we call as the onychomycosis or the tinea unguineum. Okay, so here is the very, very important images you will get in your exams. Okay, so look at the images and try to answer. Yes, which image is this? Option A. Yes, which image is this? And this option B, not option B, image B. Okay, so here is the image C. So try to identify and put the answer in the comment box, right? So is this option A? Is which image is this? Can you able to identify the image? Yes, I'm giving 30 seconds to every one of you. Do identify the image, Fatafat? Just now only I told, if the fungal infection which is happening in the groin area, okay, if the fungal infection which is happening in the groin area, so this is what you call as the tinea cruris. Very, very important. Okay, if the fungal infection happening to the foot, okay, we call that one as the tinea pedis, or we call this one as the athlete's foot. Okay, very, very important. If the fungal infection which is happening to the scalp, what is this? This is what we call as the, yes, tinea capitis, right? If the fungal infection happening to the entire body, look at this particular image. Okay, if the fungal infection is happening to the entire body, right? So this is what we call as the tinea corporis. Very, very important terminology, beta. Definitely it will strike in the exam. You have to remember these all things. Okay, right? Yes, here is the very, very important treatment. So we are using the first line treatment for the our fungal infection, topical antifungal drugs. Here we will use the clotrimazole, meconazole, ketoconazole, and the terbinafine. Okay, so here you will get the ketoconazole in the all format. Okay, so you will get in the oral format, you will get in the IV format, along with you will get the shampoo of the ketoconazole also for the this particular head wash in the tinea capitis. Okay, so very, very important. These are the first line drugs. That is the CMKT. Okay, CMKT is the, there is the clotrimazole, meconazole, ketoconazole, terbinafine. Okay, so very, very important. And our other oral antifungal drugs we have is the fluconazole and itraconazole, terbinafine. Okay, so these are the drugs we are using here. Very, very important. We have to keep in our mind, right? So the next one is the candidiasis. This is your 5-star. Definitely asking question in the upcoming Norcet exam. Okay, so that is the candidiasis. Remember one word that is related to the candidiasis, that is, yes, so that is very, very importantly, wherever the immunity will decreases, that time the risk of the candidiasis will be increases. This is the keyword you have to remember in your mind. Okay, what is the candidiasis keyword you have to remember in your mind? So wherever there is a low immunity, the risk of the candidiasis will be increasing. Okay, so this is the very basic thing we have to keep in our mind while approaching the question of the candidiasis. Okay, so let's quickly revise all the golden points on the candidiasis, and we will go for the question also on the candidiasis. Okay, so candidiasis is a fungal infection which is caused by the Candida species. Okay, which is caused by the Candida species, and the most common cause of the candidiasis is the Candida albicans. Okay, so this is the golden word. Okay, golden word for example. Okay, it can affect the mouth also, throat also, genitalia means the vaginal candidiasis also will happen, cutaneous candidiasis, there is the skin will also happens, nail candidiasis also can happen, and even the candidiasis can go the systemic circulation also. Okay, so very importantly, the mostly it will happen to the vaginal area and the oral area and the vaginal area. Okay, so very important, we have to keep in our mind. Okay, so mainly in immunocompromised individual, the risk of the candidiasis will be double, triple. Okay, so wherever the immunity decreases, there is increased risk of candidiasis. A key term what we have to keep in our mind. Okay, so very importantly, we have the types of the candidiasis also. First and the very important candidiasis, that is the oral candidiasis. For this oral candidiasis, we also call as on the oral thrush also. Okay, so oral candidiasis is also called as the oral thrush. So whenever we will examine the oral cavity of the patient, there the white patches on the tongue and on the cheeks and the throat. Okay, so the white patches which are available on the tongue, cheeks and throat, so that is the indicating the oral candidiasis, and which makes the patient to difficulty in the swallowing. Okay, so in the severe cases, and that source are the whatever the thrush or the ulcers are there in the mouth, which are burning ulcers, and which are the creates the soreness also in the mouth. Okay, so very important, the oral candidiasis. Okay, so whenever we will examine the mouth of the person, there will be a white patches. Okay, so we have to keep in our mind very important thing related to oral candidiasis. And here the esophageal candidiasis. Esophageal candidiasis is a Candida infection at the esophagus, the most commonly associated with the HIV and AIDS. Okay, esophageal candidiasis will be in the HIV AIDS. Similarly, okay, there is low immunity because of this human immunodeficiency virus. It will directly affect and attack the CD4 cells. So CD4 cells are the immune cells, the cluster differentiating type 4 cell are the very important immune cells. So this particular HIV, it will directly attack the CD4 cells and decreases the CD4 count. So CD4 count is decreasing means the risk of the infection is increasing, right? So wherever the decrease immunity, then the risk of the candidiasis will be more. Okay, so in the HIV and AIDS conditions, so and in the immunocompromised patients, esophageal viruses will be happening. Here the patient will get the white color rashes in the esophagus. Along with that, the patient will be getting the painful swallowing. That's the difficulty in the swallowing. Okay, so not difficulty, so pain during the swallowing. Okay, so there is a dysphagia, odonophagia, two terms are there. Okay, so dysphagia means while swallowing there is difficulty, that is what we call as the dysphagia. Odonophagia means so while swallowing there is pain. Okay, so pain during the swallowing is the odonophagia. Okay, pain during the difficulty during the swallowing is the dysphagia. Okay, in the oral candidiasis, the patient is getting the dysphagia, that is the difficulty in the swallowing. But in the esophageal candidiasis, the patient is getting the pain. Okay, that is the odonophagia. Okay, so painful swallowing will be there. And here is our esophagus. If the esophagus is getting the candidiasis, so chest pain also will happen, and the patient will get the nausea also. Okay, so chest pain, nausea, and the painful swallowing, so which will be associated symptoms with the esophageal candidiasis. Only one word you have to remember related to esophageal candidiasis is it is a candidiasis associated with the immunocompromised and HIV/AIDS patient. Okay, especially HIV and AIDS patient. Okay, this is a single best word you have to remember related to the oral candidiasis. Okay, next comes to the vulvovaginal candidiasis. Okay, so this is the very important scenario based questions will be asked to you people in the exam. I will discuss the scenario based questions on the vulvovaginal candidiasis in this particular class only. Just you have to focus and watch the class till the end. Okay, so very importantly, that is vulvovaginal candidiasis, where there is the itching. The patient will complain itching, thick white vaginal discharge along with the burning sensation, so due to the infection of the Candida albicans in the vagina. So that is what we call the vulvovaginal candidiasis. So patient will complain of the white vaginal discharge, which is cottage cheese in appearance. Okay, and itching will be there. Okay, in two conditions we will get the white vaginal discharge. One is the bacterial vaginosis, there we will get the thin white vaginal discharge. Okay, so but there is no itching in the bacterial vaginosis. Itching is there, thick white vaginal discharge is there, that is the candidiasis. No itching and the thin vaginal white discharge, that is the bacterial vaginosis. We will discuss in detail by differentiating the thing because it is very important for the exam. Okay, so itching will be there, thick, okay, so not thin, it is the thick white vaginal discharge will be there. Okay, so in the bacterial vaginosis we will get the thin white vaginal discharge. Okay, along with that burning sensation will be there. Okay, so this is the very important classical symptoms of the our vulvovaginal candidiasis. Okay, so next the cutaneous candidiasis or the skin candidiasis. Okay, here the skin also get infection with the candidiasis. Wherever there is on the risk of the sweating is more, like below the breast, in the armpit, okay, in the groin area. So wherever the wet and moist region is there, so there will be an increased risk of the skin candidiasis also will be there. Okay, so the cutaneous candidiasis which affects the skin under the breast, in the groin and in the armpits. Okay, so that is the very important thing, and the skin will look red and the skin itching will be there along with the rash and the satellite lesions we will see here. Okay, so very important thing, satellite lesions will be seen in case of the our cutaneous candidiasis. Okay, and it is highest in the risk, okay, highest in the like appearance where will be a moist and irritated skin will be there, so there will be a risk is the highest. Okay, like I told, in the groin area and in the armpit and in the like below the breast. Okay, these are the very important areas, so where will be a moist skin we will get. Okay, so in the moist skin the risk of the cutaneous candidiasis will be high. Okay, so that is the very important and very basic thing we need to understand. Okay, so then comes to the Candida balanitis. Okay, so in the male only it happens because the glans penis is available only in the male. Okay, so that is the reason the Candida balanitis is the inflammation of the glans penis. Okay, so which is caused by the Candida albicans. Very importantly we need to keep in our mind, right? So what are the types of the candidiasis we have discussed? Yes, quickly revise. Candida balanitis, that is the candidial infection of the glans penis. Candida cutaneous candidiasis, there is the candidial infection of the skin where there is a increased moistness of the skin, there is increased risk of the cutaneous candidiasis. Okay, vulvovaginal candidiasis, there will be a itching, thick white vaginal discharge. Okay, so that is associated with the candidiasis. Okay, next comes to the esophageal candidiasis. Okay, so the most important thing here, it is associated with HIV and AIDS and immunocompromised patient, and odonophagia, chest pain and nausea will be associated with candidiasis. So that is the esophageal candidiasis. Okay, so next the oral thrush or the oral candidiasis. Here the white patches on the tongue will be seen along with the cheeks, throats and like soreness of the like mouth will be there, and along with that there is a ulcer will be burning in the sensation. Okay, and the patient will get the difficulty in the swallowing, there is a what we call the dysphagia. Okay, so these are the types of the candidiasis we have discussed, and the core word we have kept in our mind, there is the wherever there is less immunity there is a more risk of the candidiasis. Okay, hope you people have been understood this one. Okay, so next comes to the treatment of the candidiasis. The direct question will be asked in your exam. The drug of choice for the candidiasis is, your first answer goes to the fluconazole. Okay, so always first and best answer for the drug of choice for the candidiasis will be fluconazole. Okay, so treat the underlying cause will be the very important. Why? Because I told the candidiasis will happen due to the low immunity, right? So now if the patient came to us with the oral thrush, we have visualized the like oral cavity where the white patches we have got, and we have sent the culture and where we will get the Candida albicans positive. Then we have initiated the fluconazole, and after 3-4 days the this particular oral thrush will comes to the normal, right? So patient we will discharge. Then the patient after 1 week again it will comes to again same complaints of the oral thrush. Why? Because this oral candidiasis or the vaginal candidiasis which is happening due to the immunosuppression. So just we are treating the candidiasis, we are not treating the immunosuppression state here. So again there is the risk of the recurrent candidiasis will be there. So that is the reason management of the candidiasis also important. Along with that, our target of the treatment in the candidiasis should be improve the immunity. Okay, so wherever there is the immunosuppression, there is a risk of the candidiasis is more. Okay, so if I am improving the immunity, means risk of the candidiasis is less. Okay, so the treat underlying cause of the immunosuppression. Okay, so here the immunosuppression that may be due to the overuse of the steroid, immunosuppression that may be due to the HIV and AIDS, and immunosuppression that may be due to the any like cancer therapy we are giving, the chemotherapy we are giving, radiation therapy. So in that particular condition, there is highest risk of the immunosuppression will be there. Okay. So and in case of the leukocytopenia means there is a decrease in the WBC. So risk of the infection will be more here. Okay. That is the reason. So wherever there is on the low immunity is there, the more candidiasis risk will be there. So target of the treatment is to improve the immunity. So whenever the immunity will improve, the risk of the candidiasis will automatically reduces. Okay. So remember, steroids increases the risk of the candidiasis. So there is a scenario based questions that may strikes in your exam on the steroid. Okay. So for example, consider a patient with asthma. Okay, patient with asthma who is using the inhalational steroid. Okay, who is using the inhalational steroid. Okay, so inhalational steroid if the patient is using means he will inhale that one through the oral cavity. Okay, so you know the puff we have to keep in our the meterodose inhaler. So we have to keep here and we have to push the steroid inside the body. Okay, so there is a accumulation of the steroid will be there in the mouth. Okay, so the steroid will get accumulates in the mouth. So that is the reason. Okay, so steroid will accumulate in mouth. Okay, so when the steroid will start accumulates in mouth, so the immunity in mouth decreases. So decreased immunity in mouth means there is increased risk of the oral thrush. Okay, so which means increased risk of oral candidiasis. Sir, then what is the solution for this one, sir? Yes, just a simple nursing education is the solution for this one. Okay, so in this particular scenario, just we have to ask the patient to rinse the mouth, after using inhalational steroid. Okay, so this is the solution for this one. Okay, very important, we have to keep in our mind. So steroid increases the risk of the candidiasis. So for example, the patient which is using the inhalational steroid in case of the asthma. Okay, so the steroid will get accumulates in the mouth. The steroid is accumulating means the immunity in the mouth will decrease. Means the steroid is also visibly very much like it is like a nutrition to the bacteria, right? So which is a nutrition to the fungus also, because the steroid is rich in the glucose, right? So the glucose is more in the mouth and the immunity is less in the mouth means the risk of the immunity risk of the infection will be there. Okay, so immunity will decrease and increase the risk of the oral candidiasis will be there. So that is the reason whenever the patient will use the meterodose inhaler, that is the he used for the steroid inhalation. So we will ask the patient to rinse the mouth, okay, after using the inhalational steroid. So this is the important concept. Okay, this is the important concept for your upcoming exam. Okay, so let's discuss and solve some very important MCQ for you all, right? Which species is most common responsible for candidiasis? Option A, Candida tropicalis. Option B, Candida glabrata. Okay, so option C, Candida albicans. Option B is the Candida krusei. Okay, so what is the correct answer? Already we have discussed the most common species which is responsible for causing the candidiasis of the oral cavity, vaginal cavity, skin, and all other candidiasis like esophageal candidiasis. The most commonly responsible candidiasis is our Candida albicans. Okay, so already discussed in the theory portion. Just I am brushing your knowledge. Okay, so the next question is here in front of you all. Okay, so try to solve this particular question, which is very important, right? So what is the drug of choice for the oral candidiasis in the immunocompromised patient? Yes, already we have discussed the drug of choice for the oral candidiasis in the immunocompromised patient is the fluconazole, and amphotericin B will be used in the rare and candidiasis which is not resolved by the initial treatment. Okay, and this is usually we will use drug of choice for Kalajar. Okay, so very importantly we have to keep in our mind, and wherever the patient is using the amphotericin B, there is highest risk of the side effect of the hypocalcemia and magnesemia. Okay, so very importantly, so we have to keep in our mind. Okay, so that is the important thing, just we have to keep in our mind. Okay, already discussed the portion, just you have to keep one word, that is the drug of choice for the our Kala Azar will be the amphotericin B, and drug of choice for the oral candidiasis in the immunocompromised patient is the fluconazole. Okay, so hope you have understood the particular question. Okay, so already discussed in the last theory portion, right? So here is the very important scenario based question which will strike in your Norcet 9. Okay, so try to solve this particular question. Okay, so it will definitely gives you a good rank in the exams. Okay, so just look at this particular question. A 25-year-old woman comes to the clinic with complaints of vaginal itching. Vaginal itching will be there. Okay, so look at the words, vaginal itching is there, and burning also which is there for the past 2 days. Okay, since from the last 2 days she is getting the vaginal itching and the burning. Okay, she also noticed a thick white discharge from the vagina. Okay, and she says that discharge looks like a curd or cottage cheese. Okay, so discharge which is looking like a curd or which is looking like a cottage cheese. Okay, and there is no any bad smell. Okay, and she is not sexually active. Okay, and she doesn't have any fevers also, and there is no fever, and otherwise healthy. She is completely healthy, and she recently finished a course of the antibiotic for the urinary tract infection. Okay, so what is the most likely diagnosis here? Better. So I told in the trichomoniasis the patient will get a yellowish color of the discharge. Okay, not white color. So I'm eliminating the option A here. Okay, so yes, the itching will be there and the yellowish greenish yellow color discharge will be there, but there is no white color discharge. But in the history she is telling which is a thick and which is white discharge and which looks like a curd. Okay, so that is the very importantly a classical picture of the candida or vulvovaginal candidiasis. Okay, so in the bacterial vaginosis also we will get the white color discharge, but there is no itching. Okay, so there is no itching, but in the history she is telling there is a vaginal itching will be there. Okay, so I'm eliminating the option B also. Next comes to the option C, there is the vulvovaginal candidiasis. Yes, in the vulvovaginal candidiasis there is the itching is there, white color discharge is there, and very importantly she will be having a recent history of the antibiotic use. Okay, recent history of antibiotic use. Okay, so look at the last line. Okay, she recently finished a course of the antibiotic for the urinary tract infection. Okay, so this made the destruction of the normal colon bacteria. Okay, so normal colonization of the bacteria is destroyed means the immunity will be suppressed here. Okay, so that is the very important, so we have to keep in our mind. Okay, right? So option C goes to the correct answer here. You people must and should know this very important chart for your exam, and this will be the, believe me, very important chart. Okay, so these features you are able to identify in the scenario based questions means the definitely result and rank will be yours, right? So let's discuss the vaginal candidiasis. In the vaginal candidiasis, the causative organism of the vaginal candidiasis is fungus. Okay, which is not a sexually transmitted disease. Means in the history the female gives she is not sexually active. Okay, so just we have discussed the question of the vaginal candidiasis. She told she is not sexually active, but still there is a thick white color cottage cheese or the curd like discharge is coming out of the vagina. Okay, so the female is not sexually active. Okay, and she is complaining of the thick white cottage cheese or the curd like discharge which is coming out of the vagina. Okay, and it is not having any bad smell, right? There is no bad smell, right? Intense itching will be there and the burning sensation will be there. When we will check the vaginal pH, it is completely normal. Okay, so which is less than 4.5 only. Okay, and when we will see the microscopically finding the budding yeast or the pseudophytes we will get. Okay, so pseudohypes and a budding yeast we will get in the microscopic examination. Okay, when we will do the whip test, there's the by using the 10% of the potassium hydroxide we will do the whip test, means the vaginal secretion we will take and we will take the 10% KOH and we will mix together, so there is a formation of the fishy smell. So fish like smell which is generating means that is the positive whip test. That one we will get in the bacterial vaginosis. not in the Candida albicans. Okay, so the KYH whip test will be negative here. Okay, so very importantly, keep in your mind, and the drug of choice for the Candida vaginosis is going to the fluconazole. Okay, so very important, just we have to keep in our mind. Okay, so let's again, I will discuss the vaginal candidiasis. Vaginal candidiasis will be caused by the fungus, that is the Candida albicans, and which is not a sexually transmitted disease. Let's discuss this vaginal candidiasis by comparing with the bacterial vaginosis. This will give the rank. Okay, this will give the clarity in the concept. Okay, the clarity in the concept will give the rank. Okay, so look at this particular two very important difference. But the bacterial vaginosis. Okay, so look at this one. This is the vaginosis, which is not an vaginitis, right? So in the bacterial vaginosis, there is no inflammation. Means there is no any burning sensation. There is no any pain. Okay, so there is no any itching. Okay, so there is no itching, right? Very important. But due to the bacteria, that is the Gardnerella vaginalis. So this particular bacteria, that is the Gardnerella vaginalis, which is responsible for the bacterial vaginosis. So this particular very important bacteria, which is actually not a sexually transmitted disease, but it is associated with the recent sexual activity. Okay, so that is the thing we have to keep in our mind. And this Gardnerella bacteria, whenever it will mix with the 10% KYH, so it will form the fishy color smell. Sorry, the fishy smell which will be generated. Okay, that will be a positive whip test will be there. Okay, so just we are comparing the vaginal candidiasis and bacterial vaginosis now. Focus now. Okay, so bacterial vaginosis is the bacterial disease. Okay, vaginalis means both are the, these all three are the vaginitis, means the inflammation of the vagina will be there. Okay, infection of the vagina will be there, but the differentiation and choosing the answer matters a lot. Okay, so bacterial vaginosis is the bacterial condition, vaginal candidiasis is the fungal condition. The causative organism of the bacterial vaginosis is the Gardnerella vaginalis, and the causative organism for the fungal candidiasis is the Candida albicans. Okay, so vaginal candidiasis is not associated with the sexually transmitted disease, and it is not associated with the recent sex activity. Okay, but the bacterial vaginosis, it is associated with the recent sexual activity, but it is not STD, right? So the next very important thing, discharge appearance. Okay, so whatever the vaginal discharge is coming out, so appearance of the discharge will be the very important and the key feature which will differentiate the both vaginal candidiasis and the bacterial vaginosis. Okay, so look at this one. In the vaginal candidiasis, there will be the thick discharge will be there, right? So in the bacterial vaginosis, the discharge will be thin and the discharge will be watery. Okay, and here it is the white will be there. So this will be the grayish white, or we can say this is also a white. Okay, so but this is the cottage cheese like or the curd like, means it is thick, but the bacterial vaginosis, it is the thin discharge. Okay, and very importantly, in the bacterial vaginosis, the discharge which is not having any smell, but in the bacterial vaginosis, the discharge which is coming out of the vagina, which is having the fishy smell. Okay, and when we will ask for the woman, is there any itching is there? Yes, in the bacterial vaginosis, there is very dangerous, intense itching will be there, but the itching or irritation will be completely absent in the bacterial vaginosis. There is no itching in the bacterial vaginosis, but there is intense itching will be there in the Candida albicans. Okay, so very importantly, when we will check the vaginal pH, so this bacterial infection where it replaces the normal bacterial vaginal flora. So in the normal bacterial vaginal flora, which bacteria we have? Yes, that is the Candida, not Candida, that is the, yes, Lactobacillus acidophilus we can say. So that particular Lactobacillus acidophilus, or another name of the Lactobacillus acidophilus is the daughterline bacillus. Okay, the question will be struck in your exam. Okay, write it, the very important question. Okay, make a note. Normal vaginal flora, made of daughterline bacilli. This daughterline bacilli we also known as Lactobacillus acidophilus. Okay, so Lactobacillus acidophilus. Whenever there is in the bacterial vaginosis will happens, in the bacterial vaginosis, the Gardnerella bacteria, what it will do, it will replaces the daughterline bacilli. Means whenever it will replaces the space of the daughterland bacilli. Okay, so daughterland bacilli, which is responsible for maintaining the vaginal pH to acidic. Okay, so if there is no daughterland bacilli, the daughterland bacilli is replaced by the Gardnerella, so there the pH will be increases. Okay, so there will be increased pH will be there, so the pH will be completely alkaline, it will brings. Okay, so that is the reason when we will check a pH in the bacterial vaginosis, the pH will be increased. Okay, so very important. And when we will see the secretion of the vaginal discharge, we will get the clue cells. Okay, the clue cells will be getting in the a very important classical picture of the bacterial vaginosis. That is the finding of the clue cells. Okay, so clue cells means the epithelial cells. Okay, so epithelial cells which is coated by the bacteria. So this is what we call the clue cells. So these clue cells will be seen in case of the bacterial vaginosis, and the clue cell will not be seen in the Candida albicans. Okay, so very importantly, a whip test will be positive in the bacterial vaginosis. What is the whip test? So I will take the vaginal discharge and I will take the KOH. Okay, and I will mix both. Okay, so after mixing the both, there will be a fishy smell will become. Okay, so if the fishy shell will be released, that is the positive whip test that will be found in the case of the bacterial vaginosis. Okay, so the whip test will be negative in case of the Candida albicans. Okay, the treatment again comes to metronidazole is the drug of choice for the bacterial vaginosis, and the fluconazole is the drug of choice for the Candida vaginosis. Okay, very important thing. Just we have to keep in our mind. Better, it takes time, but it will give us the marks. Okay, so quickly revise once again. Okay, so just take a 3-4 second and quickly revise once again. Okay, so that's the simple difference we have to understand. Bacterial vaginosis, there is white discharge, but there is no itching, and positive web test and present of the clue cells, and vaginal pH will be more than 4.5. Okay, so very important thing. And drug of choice will be the metronidazole. Vaginal candidiasis, fungal infection, thick white color discharge, that is the cottage cheese or the curd like discharge will be there, but there is no smell and there is intense itching will be there. Okay, and the pH will be less than 4.5 or the normal we can say. Okay, and the drug of choice is the fluconazole. These things only you have to remember, right? So the next one, the different thing from the everything, that is the trichomoniasis. Okay, so trichomoniasis you will not have any confusion because the discharge will be having the different color here. Okay, so in the bacterial vaginosis, vaginal candidiasis white discharge, that is the reason. So we will go for the next thing, that is the itching is there or not. Itching is there, that is the vaginal candidiasis. No itching, bacterial candidiasis. Sorry, bacterial vaginosis. Okay, so in the trichomoniasis, okay, so which is the protozoa, that is the Trichomonas vaginalis. So this one we will get in patients which is sexually active. Okay, this is a sexually transmitted disease. Okay, and very importantly, discharge which is coming here is the greenish yellow in color and frothy and very much bad smell. Okay, so the next one is like the smell of the discharge is the foul smelling, and okay, when you will see itching, yes, there is a itching will be there which is very much intense in the nature. Okay, so vaginal pH will be elevated. Why? Because this particular protozoa also which will replace as the daughterland bacilli. Okay, so the next one, microscopic finding. So here we will get the motile flagellated protozoa like this. This is the flagellated protozoa. Okay, so we will get in the case of the motile means the moving flagellated protozoa we will get in the microscopic examination of the vaginal discharge. Okay, so whip test will be may be positive, may not be positive. Okay, so it may be positive, but whip test is classically positive in case of the bacterial vaginosis only. Okay, so treatment for this protozoal infection, there is the Trichomonas vaginalis. So that is the metronidazole. Okay, so metronidazole is the drug of choice, right? Hope it is clear to every one of you. So now in the question, you are having the complete clarity. Okay, so look at this one. A 25-year-old woman comes to clinic which complains of the vaginal itching. Okay, vaginal itching is there and burning sensation is there, white discharge is there. That is our vulvovaginal candidiasis, right? That is our vulvovaginal candidiasis. Instead of this one, there is no vaginal itching and like there is thin and white discharge. Thin and white discharge means that is the bacterial vaginalis. Okay, so bacterial vaginosis. In case instead of that, there is the vaginal itching, burning sensation, and there is the greenish yellow discharge. There's the trichomoniasis. Okay, so hope it is clear to every one of you. And pelvic inflammatory disease, which is not a part of the vaginitis. Okay, so which is in the pelvic like pelvic inflammatory diseases, we will study the all the pelvic organ inflammation. Okay, so like we'll study the salpingitis, there is the infection inflammation of the fallopian tube, and endometritis. Okay, there is the infection inflammation of the endometrium, and we will study the like ovaritis, there is the infection inflammation of the ovary. Okay, and we will study the cervicitis also. Okay, that is the part of the our pelvic inflammatory diseases, right? So vaginitis is not a part of the pelvic inflammatory diseases, keep in your mind, right? So the next thing which we are having here is that is a very, very important thing for our exam. A herpes zoster is caused by the reactivation of the which virus? The very important concept. Till now, what we have discussed is the fungal infection of the skin, that is the Tinea cruris, Tinea corporis, Tinea pedis, Tinea and menmenum and Tinea unguineum. Okay, so we have discussed the very important thing along with the image based questions. Along with after that we have discussed the candidiasis. So I have given the differentiation between the candidiasis of the vagina and the bacterial vaginosis, and very, very importantly we have differentiated with the trichomoniasis also, and all the cause to organism and its clinical picture and its treatment also we have discussed. So definitely one question will strike in your exam. Okay, so next one, a very, very important thing here we have, here is the herpes zoster. Okay, so now we will discuss the skin infection that is related to the herpes zoster. Okay, so the question is, herpes zoster is caused by the reactivation of the which virus? Better. So there is one concept we have to keep in our mind. So that is related to the herpes zoster. So whenever the patient will get the chicken pox, okay, so in the chicken pox, it will be caused by the every one of you, that is the varicella zoster virus. Okay, VZV. Okay, so this varicella zoster virus, when we will give treatment, so it will get reduces, but it will get stored in dorsal nerve root ganglia of the spinal cord. Okay, so it will be stored in the dorsal nerve root ganglia of spinal cord. Okay, so whenever there is in the decreased immunity, whenever the patient will comes to the decreased immunity, this particular varicella zoster virus, it will get reactivated. Okay, so whenever there is a decreased immunity, at that time the varicella zoster virus, it will get reactivated, and it will cause the very, very important called, this is called as the herpes zoster. So this herpes zoster, so that will be a very, very important thing. So here the patient, okay, so who is getting the herpes zoster, right? So which is caused by the reactivation of the varicella zoster virus. Okay, so I told, so the patient will be having the history of the chicken pox, which is caused by the varicella zoster virus, and after treatment also this varicella zoster virus, it will be get stored in the dorsal nerve root ganglia, okay, of the spinal cord. Whenever there is decreased immunity, that time this particular varicella zoster virus or the VZV, it will get reactivated, and which will cause the, okay, so which it will cause the disease condition called as the herpes zoster. Sir, how to identify this one, sir? Let's understand the complete concept of the herpes zoster here. So this herpes zoster we also call as in the shingles. Okay, so we will call this one as in the shingles. Okay, not shingles. Okay, N will be silent here. So this will be also known as the shingles. Okay, so here it is the reactivation of the varicella zoster virus. Okay, it is the reactivation, means a chicken pox happened, and after the recovery done, and thus this particular VZV virus, it gets stored in the like spinal dorsal nerve ganglia of the spinal cord, and whenever there is weakened immunity, that time it is get reactivated. Okay, so it is the reactivation of the varicella zoster virus. Okay, so the same virus that causes the chicken pox. Okay, so very, very importantly, so already we have discussed this point, and after person recovery from the chicken pox, okay, so the virus will remains in the dorsal nerve ganglia of the spinal cord. Okay, and which can be reactivated later in the life. especially when the immunity is weakened. Okay, so this is the concept already we have discussed here. Okay, so the chickenpox, which is happened by the varicella zoster virus, after the treatment, so this particular varicella zoster virus will be stored in the dorsal nerve root ganglia of the spinal cord, and whenever there is a less immunity, the reactivation of this particular varicella zoster virus happens, and which may leads to the herpes zoster. Okay, so we will have the classical rash in the herpes zoster, which will be asked in your exam in the direct question. Okay, so the rash in the herpes zoster is typically option A bilateral, option B, option is the bilateral and symmetrical rashes, option C diffuse and generalized rashes will be there, option C unilateral and follows the dermatome. Okay, and option D localized to the palms and soles. Okay, which is localized to the palms and soles. So what is the correct answer for this one? Let's discuss the thing, right? So the unilateral rash in the dermatomal pattern is the classical sign of the herpes zoster or the shingles. Sir, why, sir? Yes, so that is the concept I will explain here. So look at this particular image. Okay, so this is the ventral root, this is our spinal cord. Okay, this is our spinal cord, and here we have the dorsal root ganglion, and here we have the ventral root ganglion. Okay, so in the dorsal root ganglion, just try to focus here. Are you able to see? This is the dorsal root ganglia, means the group of the nerve cells in the dorsal column of the spinal cord. So that is the dorsal root ganglia. Inside this one, are you able to see the dot dots? So these dot dots. So these dot dots are our varicella zoster virus, which are stored in our dorsal root ganglion. Okay, so this particular dorsal root ganglion, which will be supplying the nerve. Okay, so which will be supplying the nerve to the particular area of the back of the body. Okay, so look at this particular part. If this particular dorsal root ganglia, which is supplying the nerve to this particular part, okay, so this skin is only will have the particular the rashes will be there. Okay, so the particular rashes will be there here in this particular skin only. Okay, give me a second. Yes, so one nerve root and its particular skin, which is having the rashes. Okay, so due to this nerve root, one particular nerve and its particular part of the skin, which is having the rashes, we call this one as in the dermatome distribution of the rashes. Okay, so what is the dermatome? Dermatome is the simple thing. Okay, so one particular nerve root with its specific part of the supply. Okay, so this is my skin and the nerve root which is supplying to this particular part of the skin. So that particular nerve root and the skin together I will call as the dermatome. Okay, so that one I will call as the dermatome. Here a nerve which is supplying to the particular area, so that particular area only the rashes will be happen. So that is the reason. Okay, so look at this one. If this particular side of the nerve are in, like there are storage of the varicella zoster virus will be there, so only one side of the body we will get the rashes. Okay, so that is the always the lateral rashes will be unilateral, means one side, and rash will be dermatome in pattern. Okay, so means wherever the one nerve root is going and it's supplying to the particular skin, in that particular skin only we will get the rashes. Okay, so this is what we call the unilateral rash in the dermatome pattern. So that is the classical. Okay, it will be commonly seen in the trunk, thorax and the face. Okay, so if that particular rashes like the varicella zoster virus which is infected the facial nerve, so the rash will get in the faces also. Okay, so which is stored and which is impacted to the nerve which is supplying to the thorax. Okay, we will get the rashes in the thorax also. If the nerve which is stored in the only nerve which is supplying to the back, okay, so in the back only we will get the rashes. Okay, but it is commonly seen in the trunk also, thorax also, face also, which may involve the eye also. Okay, that is the very much dangerous and the medical emergency. Okay, so that is the very important thing, but it will be a dermatome in nature. Okay, so the classical or the rash that happens in the herpes zoster is typically a unilateral in nature, and the rash which happens in the herpes zoster are the unilateral in nature and which will follows the dermatome only. Okay, so that's the very important thing what we have to keep in our mind, right? So hope it is clear to every one of you. And the next concept and the question is here. So which of the following is the most common complication of the herpes zoster? So most common complication of the herpes zoster. Students, remember one more very important concept. Okay, so whenever the patient will get the herpes zoster infection, we need to start the antiviral drugs within 72 hours. Okay, so if we are delaying in the starting the antiviral drug after 72 hours means, so whenever we will give the, even after giving the complete treatment, still this varicella zoster virus, it will get stored in the dorsal root ganglion. Okay, so and it will also storing in the sensory nerves of the spinal cord, means it will damages the sensory nerves. Okay, so that is the reason even after treatment also the patient will get a nerve pain. Okay, so that is the most common complication of the herpes zoster. Why? Because the varicella zoster virus, which is storing in the sensory nerve of the dorsal ganglia. Okay, so that is the reason even after the complete treatment also the patient will get the herpetic pain. Okay, so after the herpetic zoster, there is the post herpetic, means after the herpetic zoster the patient is getting the nerve pain. So this is what you call as the most common complication of the herpes zoster. So there is the post herpetic neuralgia. So here we will get the drug of choice for this one is the tablet gabapentin. Okay, so tablet gabapentin will be given, so for the managing the pain here. Okay, so that's the very important thing. And to prevent this particular post herpetic neuralgia, we need to start the treatment within 72 hours. Okay, so let's discuss some very important points on the post herpetic neuralgia, because it's very important. Okay, so post herpetic neuralgia is a like persistently nerve pain that continues after the rash. Okay, so after the rash is completely healed, so now still the pain is there. Why? Because we have started the treatment late. Okay, that is what we call as the post herpetic neuralgia, is a persistent pain that continues after the rash of the herpes zoster has been healed. Okay, so even after the complete treatment the rashes are completely healed, so still the patient is getting the nerve pain. Because why? Because so there is a damage to the sensory nerves from the varicella zoster virus. So reactivation of the varicella zoster virus, which will damage the sensory nerves. So that is the reason the patient will get the burning, shooting, stabbing, or the electrical shock like pain will be getting in the patient even after the complete treatment, even after the herpes zoster rashes heals. Okay, so where will be the location of the pain? So the location of the pain is where? So last time the rashes have been appeared in the same area. Okay, so pain location. Okay, so it is the same area as the previous rashes, but after healing the rashes it will start. So then only we will call a post herpes, okay, neuralgia. Okay, so that is very important. But rashes will disappear, then the still the neurologic pain will be there because of the damage to the sensory neurons in the herpes zoster. Okay, so the prevention. So how to prevent this one? To prevent it, we need to start the antiviral drug early. Okay, so there is the early antiviral treatment. So there is the within 72 hours of the rashes. Okay, so which reduces the risk. Okay, that will be a very important thing. Just we need to keep in our mind. Okay, so these are the very important thing we have discussed in the today's session. And here is the next most important thing. So that is the related to the Impetigo. Okay, so this is the Impetigo, very important for our exam. Okay, so we'll discuss the Impetigo in detail. Okay, I hope till now we have discussed the Candidiasis, the most important, all the type of the Candidiasis, the treatment of the Candidiasis. After this, we have discussed the herpes zoster. The golden point to be keep in our mind in the herpes zoster will be the chickenpox history. Okay, so after that, the patient like is getting the low immunocompromised. Why? Because in the chickenpox, which is caused by the varicella zoster virus, so that varicella zoster virus, it will get stored in the dorsal root nerve ganglia. Okay, so whenever the immunity is decreased at that time, the risk like the herpes zoster virus, sorry, the varicella zoster virus, it will get reactivated. Okay, and it will get reactivated, which causes the herpes zoster, and the rashes will be in the dermatome pattern. Okay, so wherever the nerve root is infected, nerve root is applying, there only we will get the rashes. And the most common complication, that is the post herpetic neuralgia, means even after complete treatment, even after complete healing of the rashes of the herpes zoster, the patient will get the nerve pain because the reactivated varicella zoster virus, which have been damaged the sensory nerve. Okay, so this is the very important concept where what we have kept in the herpes zoster. Okay, so like before that one we have discussed the candidiasis, and in that one, so very important difference in between the bacterial vaginosis and vaginal candidiasis, and the oral thrush and its classical feature, and all other candidiasis we have discussed in detail. And before that we have discussed the fungal infections. Okay, that is the tinea capitis, tinea corporis, tinea pedis, tinea cruris. Okay, so many things we have discussed in the fungal conditions. Okay, so these are the very important things in the dermatology what we have to keep in our mind. Okay, so the next very important thing is the Impetigo. Okay, so we will discuss the Impetigo in detail here. So again we will discuss all the golden point chanting on the Impetigo. Okay, so the classical appearance of the non-bullous, okay, Impetigo includes. Okay, so what is the classic appearance we will see in a patient with the non-bullous Impetigo? Yes, so in the Impetigo we will study mainly three type of the Impetigo. One is the non-bullous Impetigo, another one is the bullous Impetigo, and another one is the echidna like Impetigo. Okay, so that one we will discuss in the later part. Okay, just try to give the answer for this question. This is the very important question, and the Impetigo is the very important concept, because this is the most common superficial skin infection. Many times the children will come to the hospital with this Impetigo. Okay, so that is the reason the clinicians and the like wherever you are going to practice, you will like you will see the patient of the Impetigo. Okay, so in the dermatology. Okay, so that is the reason it is the most common, and it is a superficial skin infection. So there is, it is having the classical picture where we can look and diagnosis easily. That is the reason there is the highest chance of asking the image based question also and the classical picture also. Okay, so let's discuss this particular Impetigo in detail and very quickly with golden point chanting. Okay, so the classical appearance of the non-bullous Impetigo includes, yes, honey colored crust will be the a very important classical picture we will get in a patient with the Impetigo. Okay, so look at this one. Around the mouth, here will be the honey colored crust will be there. Okay, so here it is not having the any type of the fluid filled cavity is not there, only the honey colored crust will be there. So this is what we call as the non-bullous Impetigo. Okay, what is this? This is the non-bullous Impetigo. Very important. Okay, so in the bullous Impetigo we will get the fluid filled bullae. Okay, so here we don't have the fluid filled bullae. Here we have the crust, means the ruptured what we can say that like vesicles will be there, so which looks like a honey colored crust. Okay, so that is the classic appearance we will get in the non-bullous Impetigo. Okay, so serous fluid filled vesicles will be getting in the bullous Impetigo. Okay, so let's discuss this particular Impetigo in detail. So this Impetigo is a highly contagious superficial bacterial skin infection. Okay, so which is most commonly happens in the children's, especially age group of the 2 to 6 year. Okay, so which happens to the most commonly in the children's, especially age group of the 2 to 6 year, and it is usually affects the face, arm and legs. Okay, so the most commonly it will affect the face, arm and leg. So this question will not ask. So the very important point, the Impetigo is contagious or not? Yes, it is highly contagious. Okay, it will spread easily from the contact. Okay, if I am touching my Impetigo and if I am touching you, you will be also getting the Impetigo. Okay, so Impetigo is very highly contagious, and just it is a superficial bacterial skin infection, which is mostly and commonly happens in case of the children. Okay, that is the age group of the 2 to 6 year of the age. Okay, so very important thing what we have to keep in our mind. Okay, in the types of the Impetigo we will discuss all the types. Okay, so that is the we have the three types of the Impetigo. First one is the non-bullous Impetigo. So non-bullous Impetigo is the most common type of the Impetigo. Okay, so among the three types, non-bullous, bullous and echidna, so among these three types, the most common one is the non-bullous Impetigo. Okay, so that is the non-bullous Impetigo is the most common one. And what is the most common cause for the non-bullous Impetigo? That is the Streptococcus pyogenes. Okay, so Streptococcus pyogenes is the most common cause for the our non-bullous Impetigo, right? So what is the clinical classical picture? The classical clinical picture of the non-bullous Impetigo is the honey colored crust will be the classical clinical picture of the non-bullous Impetigo. Okay, so let's come to the bullous Impetigo. Okay, in the bullous Impetigo, it is the most common cause of the bullous Impetigo is the Streptococcus aureus. Yes, the question is different, answer is different. The most common cause for the non-bullous impetigo is the Streptococcus purgens. The most common cause for the bullous impetigo is the Streptococcus aureus. Okay, so here it is the bullous. What is the bullous? Bullous is a fluid-filled vesicle. Okay, so it is what we call the bullous. This is the skin. On the skin we have the vesicle which is filled with the fluid. Okay, so we call this one as the fluid-filled vesicle. So there is the bullous, right? So in the bullous we will get the fluid-filled blister. Okay, which is classical picture of the our bullous impetigo. Okay, so next one is the echithma. Echithma is the most severe form of the impetigo, where it is the deeper ulcer will be formed in the echithma. Okay, but the non-bullous, bullous both are the superficial. So this echithma which will go deep, okay, and which will impact all the subcutaneous tissue also. Okay, that is the reason this particular echithma is the most dangerous type. Okay, so hope it is very much clear to you, every one of you. Okay, so which is highly contagious, which may directly spread through the direct contact, and which may the fomites. Okay, so if I am using the pen, okay, if consider here it is the impetigo. Okay, so just I am like rubbing like this. I am using this pen and I am keeping this pen here, and you have came to the like what, and you have taken my pen. Okay, so this is the pen, here is the fomite which is transmitting the infection from me to you. Okay, so the fomite here is the pen. Okay, so it will send the infections through the any kind of the materials which is used by the patient, which may be a pen, which may be a kerchief, which may be a towel, whatever it may be. Okay, so it may happen due to the direct contact also, and which may happen due to the fomites. Means the articles which is used by the infected persons, another person is using the same articles, so the infection will be carried to the another person. Okay, that is the fomite. Okay, very very important, we have to keep in our mind. Okay, so the treatment is the treatment of choice, or the best treatment is the 2% mupirocin ointment is the best treatment we will give in a patient with a impetigo. So this is the very very important point what we have to keep in our mind. And in the next video we will discuss related to the cellulitis, and cellulitis is the most very very important concept for the upcoming exam, and all the golden point chanting we will do on the cellulitis in the next class. Stay connected. Okay, stay motivated, keep preparing, and if any one of you have still not a part of our rapid revision courses and test series, you can just join. Okay, so by using this particular courses. Okay, so for the only test series we have the Super 60. Okay, that is the Norcet 9.0 Super 60 live test series. Okay, which will be giving you a very very important live test for 60 prelims test, 20 practice test plus 20 extra practice test. Along with that, very very importantly, mains test also free to the candidates who are enrolled in the Super 60. Okay, so if you want a high yield content questions discussion and a clarification, bifurcation, and approaching the Norcet very easily with all important question discussion and video lectures and all high yield content topic lectures, so it will be getting the Navagraha plan. So along with that, daily live test series also will get in the Navagraha plan. Okay, so just you want to prepare for the SGPG and KGM nursing officer, here we have the Arambha series, the 3000 MCQs along with the non-nursing class you will get in the Arambha series. Okay, so very very importantly, if you want to become a nursing officer in the India, in the any city, okay, in the any institute, just choose our master batch 1.0, completely study the all the topics, all the theory portions, subject wise, topic wise, along with the MCQ discussion and the test series. There is the master batch 1.0 for the quick theory revision, Norcet 9, KGMA, SGPGI, KEA, DMAR, CHO, and the Norcet 10 also will be covered in the master batch 1.0 with the validity of the 1 year. So if you want to become a part of this one, just download the master nursing classes app. So link is given in the description box and the link is given in the comment box. Thank you for watching the video. So till the end, stay connected, stay motivated, and don't forget to attend the Sunday free test. So just download the master nursing classes and follow the instructions and start the test and assess your progress. Okay, assess your where you are standing in the preparation. Okay, so why? Because all India candidates will appear the exam and the rank will be displayed in your WhatsApp and Telegram group of the master nursing classes by the 11:30 p.m. Okay, tomorrow 6 a.m. you will get the live class, you will get the live exam for the All India Norcet free exam. Okay, thank you for watching the class till the end. Stay connected, stay motivated, keep practicing. Definitely it will give a good result. Thank you so much.